So what you may not know about the next 2 days is that you're actually going to be asked to do double duty. And what I mean by that is the foundation is in the process of revisiting its mission. And that mission is to advance the core values of medical professionalism as a force to improve the quality of healthcare. As we've done surveys and some of the preliminary work around focus groups and interviews looking at this mission, one of the things that rings true loud and clear is that people think that professionalism is important. It needs to be maintained in that mission. And there's also this idea that it's a vague concept more than ever now, even with some negative connotations among some groups. And so there's a desire to better define what do we mean by professionalism as a force to improve quality. You know, building on some of the prior work we've done around trust and recognizing that the foundation of trust is professionalism, we're going to look to examine that connection and how professionalism can help strengthen that trust among care teams, among communities, among institutions. So looking specifically at that connection, we'll talk about some of the forces that are changing healthcare today. Things that may have been present for many years, but now we're just seeing in such a greater magnitude than ever before. Some of these forces that corporatization, financialization, that may challenge some of the traditional precepts of professionalism. And so we'll look at those and see how we can use professionalism as a way to strengthen those values, kind of push back, if you will, maybe against some of these forces that may challenge some of the professionalism precepts. We'll look and have some discussions around medical education and how medical education is dealing with this changing landscape of professionalism and how that is being taught, instilled into recent graduates or not being instilled into the new graduates. And then finally, you'll be part of a series of exercises that looks at how we can develop a framework around professionalism with an eye towards action steps and things that we can do to reinforce those core values. So those are the objectives for the next couple of days. If you look at, the last time this has really been examined in depth by the foundation was back in 2002 when the physician charter was published. And that was done with the foundation in conjunction with the ACP and the European Federation of Internal Medicine. And at that time, the charter focused on these three fundamental principles and then a series of behaviors. And the principles are those listed: primacy of patient welfare, patient autonomy, and social justice. These largely reflected some of the principles that were elaborated in 1999 by the ACGME when it identified professionalism as one of the 6 core competencies to focus on. And so there were those 3 principles and then this series of professional responsibilities or behaviors. And if you go back and read that charter today, written in 2000, 2002, and I understand Troy Brennan is probably where's Troy?
Chris.
I heard you wrote that charter, is that true?
That's what I tell people.
And so, but if you go back and read it, it's remarkably contemporary. I mean, these issues are many of the same issues that we are talking about today. Granted, some of them have been greatly accelerated. If you read that article in Annals, the editor talks about one of the challenges for physicians at the time is how do you live up to these precepts while also kind of resisting some of the forces that want to impose a corporate mentality on the practice, on the profession, which is intended to be in service of others. And so that challenge was framed back in 2002, and it's the same kind of challenge that I think many of us are struggling with today. In one of the pre-reads that you had in your packet, there was an article on the unfinished business of professionalism by George Bartley, who was the CEO of the American Board of Ophthalmology. And in that article, he ends with this quote from Jordan Cohen, where he's talking about professionalism as the foundation for the contract that medicine has with society. And that medicine gets to enjoy all of these privileges as a result of that contract, and it's all based on the issue of professionalism. And so he talks about the privileges that the profession enjoys, the ability to self-regulate and autonomy, the esteem that the profession is held in, economic opportunities and such. And then he goes on to say, while those things are all very important to the profession, the stakes are even higher for the public. Because nothing, as he put, can substitute for having a trustworthy physician to safeguard the patient's interests. Not regulations, not laws, a patient's bill of rights, a watchdog agencies, fine print in an insurance contract, none of that trumps. What is the foundation of that trust? It's professionalism. And so, I think as we think about this over the next couple of days, how can we use professionalism to lean into some of these active issues that we're dealing with today as a balancing force? Historically, it's been used like that, but how do we view professionalism as a balancing force for some of these other market pressures or political pressures that can have negative influences on the patient experience? So specifically, what types of things have changed since 2002, or even beyond, before that? With so much evolution in technology and knowledge within healthcare and the explosion of those things, many of the issues of professionalism are no longer that individual practitioner and patients in the exam room. I mean, that's the history of displaying those values of patient primacy and autonomy and those types of things. So much more now is dependent upon the practitioner, is dependent upon groups and teams, dependent upon institutions for the technology that they need to do their jobs. And so the issue of organizational professionalism becomes much more prominent and important to consider. When you look back at the 2002 charter, social justice was one of the 3 fundamental principles. Today, if you use the words diversity or equity in your grant application, your grant's liable to get pulled, right? And so it's a different time in terms of what is seen as permissible in that space. And so as a profession, when we profess what values are important to us, we have to realize that as that was articulated in 2002, those pressures have only ramped up in the recent years. The explosion of information now, the democratization of knowledge, where in the past physicians sort of owned that space of knowledge and were able to impart that with the patients. Now patients are able to access that in so many more forums, and it's also provided the milieu for misinformation. And so how do we deal with misinformation in the current setting as well? So these are a few examples, a number of issues that have changed, pressures that we're facing today that may not have been present in the past. Jess is going to talk a little bit more specific about some of those and then talk a little bit about what we're going to do in the forum. Huh?
Yeah, thank you, Fred.
Thanks.
So it turns out folks have noticed that things have changed. There has been a steady drumbeat of articles and books that have come out, not just addressing the challenges to the profession, but the challenges with professionalism. And some of the authors and people who were featured in these pieces are here in the room, and you're going to hear from them. But just to give you an overview, here's what we're hearing are the challenges to and with professionalism today. One, norms shift that happens generationally. We expect this to happen. Discourse has changed. As Fred said, we're talking about burnout. We weren't doing that as much in 2002. And so we have to think a little bit differently about how we talk about and the expectations we have of the profession. Professionalism has been used to exploit people to the detriment of their well-being. We saw this a little bit during the pandemic. We heard about muffin rage. Like, I don't need another muffin. I need 3 weeks of sleep and more staff. The way it has been assessed and enforced has been to reinforce class and social norms and reinforce the patriarchy, and there is a need to revisit it. There are tensions between market and bureaucratic forces when profit is the primary goal and you are accountable to stakeholders. Those interests are at odds with patient primacy. It puts a lot of pressure on how care is delivered and the professional delivering it. And Fred talked about this, the shifting role of our relationship with knowledge and expertise. It's not just AI, it's not just technology, it's who has the biggest microphone on Twitter. And what does that mean about our expectations and the authority gradient that we have with our professionals and medical professionals in particular? In this conversation, those are big, big issues to be grappling with. And so I want to parking lot one important issue, which a lot of really important oxygen in the space has gone to, which is dealing with lapses in professionalism, remediation, and disruptive behavior. This is important work. And of course, once we codify a framework, you gotta hold people accountable to it. But for these 2 days, we're gonna be focusing on where do we go for inspiration? You know, what is our North Star? So that's what the conversation will be. And good news, I love this quote from Matt Winia, every generation gets to define what it means to be a profession. What does it mean to be a good doctor, a good nurse, a good pharmacist? What's core? And what do we need to let go of? What are we willing to stand up for? And where and how do we have that conversation today? And so we think this is as good a space as any to do that, to have a conversation about what should professionalism be today. It might be helpful to think about, okay, well, we have 2 days and a breakfast to tackle this together. How are we gonna do that? So we came up with a little scaffolding for action here. Today, we're gonna be focused on level setting around the environment. What are we swimming in? What are the forces that we're working with here? What are some of the challenges with professionalism? And tomorrow, we're going to be thinking about agency, mapping agency within ourselves, the individual, within the collective, so that could be the organizations, the practice settings, the environments we're working in, institutional, across systems, the norms and policies and regulations and structures, and then the profession, the competencies, the relationships, the leaders, positive deviance. So we'll give you this structure to kind of start to map areas of possibility and to locate them for change. But we're asking something of you. We're asking you to overcome FIGGI. FIGGI is what Joe McCannon, who is the former Director of Sustainability for the US Office of the President, he's also an expert in large-scale change. He worked with Don for a number of years on the 100,000 Lives campaign. He uses it to describe fear, ignorance, greed, and inertia. It exists in all of us to varying degrees, and right now it's an uncertain time. It's a shifting landscape. There is fear and uncertainty and anger. And nothing is more powerful to overcome those things than hope and courage and integrity. And when we stand in that space and we invite other people to do the same, it matters tactically, because it is much more powerful than fear-driven coercion. Any extrinsic motivator that we could call on will atrophy over time. Intrinsic motivation is enduring. And so we're asking you to look for places of opportunity and hope. Every day there's new technologies, new relationships, bright spots we're going to hear from. We're asking you to look in there, to call out sources of hope, and to draw from that well, to co-create a moral invitation. It's a lot to ask, but I think we can do it together. And because we don't want to confuse admiring the problem or understanding the problem for action, the goal is really to drive change and to think about what are we going to do together. And so the question we want to ask ourselves is, what do we need more of? And what's standing in the way of our getting it? Does that sound like something you're willing to do? All right. Let's give it a go.